Welcome to IRG Sports Injury Update. I'm with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy, and our guest, Caitie Paskewich, IRG physical therapist and board-certified sports medicine resident.
Caitie, tell us from a perspective of a physical therapist that's going to treat a shoulder dislocation when they come into your office, from an assessment standpoint, treatment plan, and return to activity.
Yeah, one of the biggest things we'll see is athletes who come in after a shoulder dislocation. They can vary in their injury range quite a bit. So we'll see tendon injuries, ligament injuries, nerve injuries, and all of those things we want to address. Early range of motion, slow and pain-free. We want to get their strength back. We want to make sure they have their neuromuscular control of their shoulder blade again. And all of those are how we kick off PT with a shoulder dislocation.
The shoulder's connected to the core is to the hips to the legs. So as a physical therapist, particularly sports medicine physical therapist, you're looking at the whole closed chain or kinetic chain, we call it.
That's the beauty of physical therapy. When you come in, we're going to take a look at that core. We're going to take a look at your hips. We want to make sure that your body is moving as it should entirely.
And a lot of people get back to activity. I mean, as soon as you control the pain, get the range of motion back, start working on some strength, then you're going to really work on function and really kind of be specific to return to play activities as a sports therapist.
Exactly. It's going to vary drastically by age. Some of our younger individuals we tend to be a little bit safer with because they tend to dislocate again. We try to get you back to function as soon as possible, and that's why we work on this early strengthening, early stabilization.
And anybody that has a dislocation, physical therapy is going to benefit from a standpoint of stability, strength, and function. Everybody needs that.
100%. We want you to come in after your shoulder is dislocated. We hope to start you as soon as possible once you see your orthopedic surgeon.
Caitie, thank you for your information. If you want more information regarding sports medicine or injuries, you can contact Caitie at irgpt.com. That's irgpt.com.
With over 40 neighborhood clinics around Washington, IRG has you covered. Let IRG be your family's physical therapist. Find the location nearest you at irgpt.com. That's irgpt.com.